Our next speaker will be Mr. Mohamed Basheer, is an experienced nursing professional with a distinguished career spanning over 3 decades in clinical practice, leadership, and specialized care. Mr. Basheer also contributed to Saudi clinical guideline practice in sickle cell disease and has actively participated in advancing nursing knowledge. Currently, he serves as a clinical coordinator in the bone marrow biopsy, bone marrow transplant, and clinical trials unit at King Saud University Medical City, Riyadh. Mr. Basheer, mic is yours.
Thank you very much for the introduction. I want to use this opportunity to express my thanks and appreciation for the organizing committee to give me opportunity to perform this one. I'm sure some people will be surprised that why am I still talking about building a bone marrow transplant when others are far away from transplant, making CAR T cell and gene therapy. Anyway, as you know, all the bone marrow transplants is the cornerstone of all the transplants. So if you look at Saudi Arabia currently, there's only about 8 centers for bone marrow transplant, and 5 of them are concentrated in the central region. So therefore, bone marrow transplant should be expanded in order to meet the Saudi Arabia Vision 2030. In fact, before I start this one, I want to express my thanks and appreciation for our mentors. What moved us to do bone marrow transplant is that in 2010, we sat down and looked at that almost most of our patients, we referred either to King Faisal, we referred to National Guard, they relapsed before the transplant. In 2 years, we have about 15 patients that relapse. So we sat down with the committee, with the administrators, the coordinators, and the consultants. So our head of department at that time, Prof. Khalid Saleh, contacted the MAM, specialist hospital, Prof. Hani, and then they agreed that time I was the head nurse of the Oncology Center, along with the educator called Mr. Osama. So we went to the MAM and have intensive training for 1 week. On arrival, second week, our laboratory and pharmacy also went. So by 2016, we have started our first transplant. So I want to use the opportunity to express my thanks and appreciation for Annie, who is the BMT coordinator in the MAM that time, and Jennifer, the apheresis that time. So actually, before starting, we have to start with the need of the context. The need of context is what made us to go for the transplant. Why transplant matters? It matters because we have a lot of gaps inside the transplant. So the global need for transplant is so much. So that's why we insist that transplant should be covered. Before you start a transplant, there must be a standard. The standard should be with either the global certification, like GCI and FACT. So once we have the context, we go through the standard, then we move to the readiness. In the readiness, that we make sure we have a standard building material which is available in order to do the buildings and other things. So the next most important thing is the nursing core and leaderships. Nursing is one of the cornerstone of the, nursing is the fundamental and driving factors that make the transplant a success. Once you have experienced nurse, committed nurse, and well-educated nurse, the transplant and all other things will be successful. At the same time, the bone marrow transplant, we like it, it's nice, but they have some risks and complications. What are the risks that we have? Sometimes there will be graft failure, there will be some cytopenia, there will be some needs. So therefore, once you have transplant also, you have to think forward. This is what in innovation. Innovation, what should I do in order to move forward? Then also we'll have the impact. The impact is about the quality of output which you will get. Okay, then why bone marrow matters? It matters because globally there's about 150,000 transplants every year. Well, in Saudi Arabia, based on the literature which I went around, it was about 1,000 to 1,200 patients have been transplanted in 1 year. So if you look at globally, there's more than 3.5 million patients living with hematological malignancies. Due to the deficiency of bone marrow transplant center, only about 5% of these patients are able to get transplants. So this one, it forces some patients to travel abroad in order to do transplants. This traveling abroad may cause a lot of financial strain to the family, cultural difference, and a lot of inconveniences. So if we are able to encourage and have enough bone marrow center in the kingdom, there's no need for anyone to travel abroad. Actually, the bone marrow transplant is not only just, it's a curative for most of the hematological malignancies. So therefore, it should be encouraged. So from capacity to credibility, the role of global standard. However, if we want to start a bone marrow transplant center, we have to contact the international body. This international body is that, what do? They ensure the safety and the quality of care for the patient. They make a standard of practice which we can follow in order to go in the straight way. Then competency-based, they will set up a competency whereby we will train our staff. Then the other also is continuing quality improvement program. You know, science and technology are evolving any year, so therefore we will have continuous improvement plan. The core requirement for the building bone marrow transplant center is one, we have to have a specialized infrastructure available before we start that one. Then we have to have advanced laboratory, we have to enough good multidisciplinary team. We should have also prevent infection control measures. Why it matters? The bone marrow matter and the accreditation bodies matters because they reduce the compliance and mortality, they improve transplant outcome, and they enable us to integrate with international benchmark to see whether our transplant is moving in direct or we have problem. And then it's our part of building capacity. So global standards transform BMT program from credible to safe, reliable, and international recognition. As you know, bone marrow transplants unit is not a unit, it is a complete ecosystem. So a successful bone marrow transplant program must have at least 6 of this interconnected system, although there's more than this one. One is the infrastructure which is available. The infrastructure is contained about a room, a HEPA filter room, with isolating room, with air filter and ICU. At the same time, also infrastructure, in the emergency units, you have to have a crash bed whereby any patient from post-transplanted camp can be accommodated effectively. Then we have to have a workforce. The workforce encourages specialized physician, especially transplant consultant, the nurses, the competence-based training, and continuous education. In the laboratory also, we have to have standard laboratory like HLA typing, stem cell processing, and cryopreservation. So the clinical pathway should be that standard protocol, which will guide us before the transplant, during the transplant, and the follow-up. And we have to have a very good multidisciplinary coordination group. One of the factors that we have to be in about the group is that we have to have infection control prevention. That is, they are responsible for protection of the environment, strict isolation measures, and surveillance of any infections which we can expect. The governance and data are very important. The governance, what they normally do, they create a policy and procedures which we will abide by it and follow strictly. Then we have to monitor the outcome of the treatment. The outcome of the treatment, the success on this one will help us to plan ahead of time in order to make the budget. For example, what happened to us, we started transplant is that, as I told you, that in 3 years, we maintained about 15 patients relapse when they need a transplant. So when we forward this one to the administration, they were able to accept, and we start our transplant center. Okay. So what is generally this bone marrow transplant and scopes? Yes, this bone marrow transplant is a replacement of diseased bone marrow with a healthy hematopoietic stem cell. So the common one which are available, we have the auto, which is patient-owned cells, and this has a lower immunological complication. And the other one is allogenic. This one has a potential cure, but it has a lot of complexity. Then haploidal also is available, but is not commonly used. The clinical outcome, the survival rate in bone marrow transplants about 50 to 70%, depending on the patient's condition and the clearance and eligibility. Then the curative outcome as hematological malignancy. As I mentioned, the outcome depends on the disease, patient condition, and donor matching. So, however, there is some limitation. The limitation is that some of the patients are not eligible for treatments. Some of them also have required specialized system. So, as I mentioned, they are not only. So, bone marrow is a high impact, high risk therapy, but it required advanced care. Risks and complication of bone marrow, although it's mentioned by almost all the presenters, it is my pleasure that bone marrow saves life that's why it's created, but it carried a lot of significant risks. These risks demand a vigilant prevention, early detection, and expert management. The major risks which are already been presented by other speakers, however, as you mentioned, graft-versus-host disease, it may be acute or chronic. The earliest, based on the literature of BMT, of European Society of BMT, the GFB, the acute one, about 30 to 50%, and then the chronic from 30 to 70%. So infection also leading cause of mortality and morbidity, but the most important, it can be prevented, not continuously, but the first period that we have to consider is the pre-engraftment period, as well as the first 100 days. And then there might be some organ toxicity like liver, heart, and so on. This may be due to medication and also the condition therapy. Then, unfortunately, also there may be some relapse as also graft failure. So we have to bear this one in consideration. Then haploidal transplant also is another way forward for transplant. Unfortunately, although transplant is a success, but it has some long-term effects like secondary malignancy, infertility, endocrine disorder, as well as quality of life problem. As mentioned earlier, mortality 10 to 30%, depending on disease burden and factors of transplant. What will make us to get a better transplant? It depends on patient selection. That's from the clearance periods and the management. A proper donor matching, infection control prevention, and timely intervention. Then also complications are common. Complications are common, but prevention is early by early detection. The core service of bone marrow, the fundamental of the Safe Bone Marrow program, a high-performing bone marrow program relies on this integrated, high-specialized service, which work together hand-to-hand in order to improve the quality of life. Number one of the most important that we make is that apheresis, that stem cell collection and harvesting, the donor coordination and collection of the peripheral blood cell. Then other things is the laboratory, that we have to have a laboratory which is satisfied by international organization, especially the area of the HLA typing, processing lab, cryopreservation, storage, as well as flow cytometry, whereby we can know the cell viability. And also PCR lab is essential. Then transfusion service. Before having a proper bone marrow transplant, you have to be a proper blood bank, which help in blood components, like irradiated blood, as well as availability of red cell. Because of cytopenia, most of these patients will require a transfusion. As I mentioned, there must be a available ICU in case of anything. RRT would be available, because in our hospital, we are lucky that we have a crash bed, which is available for any transplant patients. So in emergency also, we have a special card which gives to all the transplant patients. As soon as they come to the hospital, they have a fast track. Then you have to have a trained staff in order to manage in case of complication. And we have to have outpatient beds in order to manage some of the hydrations. The other important members of this transplant is clinical pharmacists. They are responsible for the chemotherapy agents, immunosuppression, and also they help in the drug monitoring in order to know the drug level of these patients. And supportive medication like also antiviral also is the duty of the pharmacists. BMT success depends on seamless integrated of multidisciplinary approach. So one system, one goal, and get better outcome. One of the most important things is nursing role across the BM journey. As we mentioned before, because when we start the transplant, the first pioneers to go are the nurses. So the nurse is consulted with the patients in all the time. For example, during the pre-transplant period, patient preparation and education, patient preparation, family preparation, physical and emotional support of the patient is important. Emotional support of the patient is very essential because anybody who mentally is not prepared, the physiology also will not respond. So therefore, psychological preparation of the patient is very essential. And more or less, these are done by the BMT coordinators. Care planning and coordination. Coordinating and multidisciplinary plan will be. This planning would involve, because for example, if any successful BMT group should have a WhatsApp group or email in order to share information and preparation. Infection control, optimize patient condition to reduce transplant problem. Venous access, also assessment of the central line as well as therapeutic
3
monitoring
minutes,
issues.
3 minutes.
Then during the transplant also, close monitoring and continuous vital sign monitoring is essential. All are done by the nurses. So early detection of intervention of this sepsis, toxicity, mucositis, or DIC also is done by the nurses. Medication administration and safe delivery of immunosuppressant also done by the nurses. Emotional support, providing empathy, reassurance, and psychological support also is duty of the nurses. So transfusion and fluid imbalance, ensuring that transfusion is maintained and accurately followed is the nurses. So if you look at this journey, nurses are one of the key drivers in this transplant period. But also, not post-transplant, what will happen? Post-transplant, the monitoring of the patient, especially the acute graft-versus-host disease, infection control is essential. Patient's caregiver education also is not only the patient. Once as a nurse is a teacher to almost all. He will teach the patient, teach the relative, teach the cleaners and others. Promotes adherence to the infection control policy is essential. Nurse also is going to be responsible for rehabilitation of the patients and then long-term follow-up. So nursing cannot be just, nurse is not just supportive, it's a transformative. So our expertise, vigilance, compassion can make difference in patient treatment and healing. So patients joining phase of the nursing focus, as I mentioned earlier, pre-transplants, patients assessment and risk education of the patient, care planning, infection prevention, venous access, and psychological support, all essential. During condition period also, the nursing focus is on safe delivery and condition of the infusion cells. So administering of the conditioning regime, monitoring of the vital sign, and assessment of the side effect, and system infusion are all the job of the nurses to be done. The early post 100 days, this is one of the crucial periods, so it needs a proper monitoring, and then notice to the physician. So during the post 100 days also, there's a possibility of chronic graft-versus-host disease, also the nurse will continue monitoring. Lastly, surveillance. After the patient discharge also, the nurse coordinator will be in consult with the patient, calling them, assessing them, following about the vaccination process, all this. So every phase is critical. Nursing excellence across all these save life, fewer complications, and better outcome. So infection control, as you know, infection, is successful invasion of the body tissue by pathogenic microorganisms.
1 minute only.
Okay, so one of the most important that we are underlooking is hand hygiene. Although hand hygiene, Hygiene is a single thing that helps the patient in order to save. The patient protective isolation, very important. Environmental control, this is not only for the nurse, even the cleaner, which is cleaning the room, should be educated. Then early detection and surveillance also is very essential. Prophylaxis antibiotics, which is to be given to us. And then engagement patient education is essential about this one. So innovation is very important. Innovation, it will help you to create and look for a chance of advancement in your transplant period. Then gap analysis, there's a lot of gap analysis. This gap analysis is clearly due. So building a class sustainable bone marrow program should have a better patient care. As time is going, let me go. Sorry. So can I go? Okay. So patient impacts, as I mentioned about, the most important thing is that building a high-performing bone marrow transplant is not just an achievement. It is a transformative which saves life and shapes the future of the nation. So therefore, with the Saudi mission of Vision 2030, bone marrow transplant would be very important to be employed. It impacts quality of life, it improves the system, it keeps patients to be treated at home, and also it gives an opportunity for the young nurses to get a better future in advancement, because currently we have BMT coordinators and laboratories, especially in the stem cell. So therefore, bone marrow transplant should be encouraged in all levels, so whereby we should have a sustainable system whereby our hematological patient can be treated without any delay. So these are my reference about the period. And these are the group which we set down in order to start our first transplant in the hospital. And this is our hospital. Thank you very much for your attention.
Thank you so much, Mohammed. Sorry, we cannot take the questions because we already ran out of time, so we will present next speaker.
Very nice presentation. Thank you, Basheer.